Welcome to the Deep Dive. You bring us the complex topics and, well, we aim to hand you back the core insights, distilled.
And today we're definitely diving into a complex one.
Yeah, something that causes, I think, a huge amount of stress and honestly sadness in long-term relationships.
Yeah.
We're talking about navigating those differences in sexual desire,
Mm.
enhancing intimacy.
It's truly one of the most critical relationship topics. We've gone through a ton of material here, clinical guidelines from groups like the European Society for Sexual Medicine, therapy workbooks, personal accounts.
For a real
A
mix.
real mix, yeah. All to get a handle on sexual desire discrepancy, or SDD.
And right off the bat, the biggest message, it seems, from all these sources is, look, if you feel like you and your partner have mismatched libidos, well, it's almost universal, especially once you're past that initial honeymoon phase.
Absolutely. It's incredibly common.
So the goal today is to help you shift perspective
Right.
away from thinking, okay, something's wrong with me or something's wrong with my partner.
Exactly. And focus instead on maybe it's a dynamic between you that needs adjusting.
That reframing feels huge.
It is, because SDD, fundamentally, it's just that difference, the difference in how often or maybe how intensely partners want sexual activity.
Okay.
And, traditionally, the focus often landed on the person with the lower desire. Like, okay, how do we fix them? Maybe diagnosing hypoactive sexual interest disorder, things like that.
Which sounds pretty rough for that person.
Yeah.
Feeling broken or getting defensive.
Totally. Pathologized, even. But the current expert consensus, especially the view from the ESSM, it completely rejects that individual approach.
So what's the alternative?
They insist SDD is relative and dyadic. It's about the two of you. The desire level itself isn't really the problem. It only becomes a clinical issue, something needing attention, when that discrepancy starts fueling distress or resentment or, real conflict in the relationship.
It's the fallout from the difference, not the difference itself.
Precisely. So think about it. If a couple doesn't have sex very often, but they're both genuinely okay with that, they feel connected.
Then there's no problem solved.
Exactly. No problem. We really have to challenge this underlying cultural idea that, a higher sex drive is somehow automatically healthier or more normal.
Right. Because normal is just what works for the couple.
What's optimal is defined by the couple. The goal isn't to magically make both partners want sex at the exact same time every time. That's unlikely in the long run.
Yeah, unrealistic.
The goal is learning how to cope with the discrepancy, which is, frankly, kind of an inevitable feature of long-term relationships. It fluctuates.
Okay, so if we accept the discrepancy, how do we cope? It seems like understanding why we're different is the first step.
Yeah.
Our sources talk about different desire styles.
Yeah, and this is fascinating because it helps explain why, attempts to initiate sex sometimes fall flat. Think of it like a spectrum. We can roughly group desire into 4 kinds of styles. First, there's spontaneous desire. This is the classic idea, maybe the Hollywood version, sudden, intense arousal that seems to come out of nowhere, maybe just from a thought. They feel ready pretty quickly.
The fast pass type.
Kinda, yeah.
Yeah.
Then you have responsive desire. This is different. It's slower, more gradual. Arousal builds in response to something external.
Like touch or feeling emotionally close.
Exactly. Touch, connection, specific erotic cues. For this person, the desire doesn't necessarily come first. The physical response, the connection, that's what unlocks the mental feeling of desire.
That's a really key difference.
Huge. Then there's contextual desire. Here, the situation is everything. Feeling safe, feeling relaxed, not being stressed or tired, the environment, all that plays a massive role. Stress is like a huge brake pedal for them.
Makes sense. And the last one.
Absent or low desire. This could be due to lots of things, physical issues, medication side effects, or sometimes deeper unresolved relationship problems.
Wow. Okay, so if you pair a spontaneous desire person with, say, a responsive or contextual one.
You can immediately see the potential for conflict, right?
Yeah. One person's expecting an instant spark, the other needs that slow burn, that connection, the right setting.
And neither's wrong, they're just different, which is why understanding the sexual script becomes so important.
The sexual script.
Explain that. It's basically the sequence of interactions, physical, emotional, psychological, that usually happen during a sexual encounter for a particular couple. It's like the roadmap you both implicitly follow, from starting things off to, well, finishing.
Got it. Like the usual routine.
Kind of. And there's a great analogy therapists use: playing jazz.
Oh, I like this.
You want that improvisation, that spontaneity, right? But good jazz improv only really works if both musicians know the basic song structure. They need
Okay.
to agree on the key, the tempo, the style.
Otherwise, it's just noise.
Exactly. If your sexual scripts don't mesh, or if one person keeps trying to play a different song, it just feels off. If the script works well, you both get into that flow state.
And if it fails, like the initiation always gets rejected or it feels rushed,
Then you leave feeling maybe hurt or frustrated, and you kind of replay it in your head, you ruminate. So often the key is to expand the script, find more ways to play together.
expand the script. Which brings us to that really surprising data point you mentioned earlier.
Ah, yes. This came from a study looking at gay and bisexual men's sexual experiences. Their scripts tend to be, let's say, less rigidly focused on one specific outcome compared to the often intercourse-centric script common in heterosexual couples.
Okay, and what did they find?
They found that only about 35% of the recent sexual encounters they studied actually included intercourse.
Only 35%. Wow. So what were they doing?
They were focusing heavily on what the researchers called outer course behaviors: kissing, cuddling, hugging, manual stimulation, oral sex, all sorts of things. And get this,
Yeah.
they documented over 1,300 different combinations of these outer course behaviors that couples engaged in.
1,300.
Yeah, that's this. 1,300 unique ways couples found to define intimacy and connection.
That totally blows up the idea that sex has to mean just one thing, like penetration leading to orgasm.
Completely. It highlights this huge potential we all have to broaden our definition of what counts as a successful, pleasurable encounter, to expand our own scripts.
So if the old, maybe rigid script isn't working, we need a new one, a healthier one. Where do we start building that? Sounds like we need some ground rules, some foundational pillars.
We definitely do. There have to be some non-negotiables. And the absolute first pillar is mutual consent.
Okay, consent. Seems obvious, but what are the details we need to focus on here?
Well, the sources break it down. Consent needs to be truly voluntary, enthusiastic, not just passive agreement informed, specific about what you're agreeing to, reversible at any time.
Reversible is key.
Absolutely, and mutual, and the person has to be competent to consent.
That's a lot to keep in mind. If I'm, say, the partner with the higher desire, what's the most critical piece of that for navigating STD?
Maybe the most crucial detail, especially with STD, is this: you cannot consent to future sex.
Ah. So if your partner says, okay, maybe later tonight.
That promise, while maybe well-intentioned, needs to be gently redirected. Something like, okay, let's just see how we both feel when we get there. Let's focus on what feels right in the moment.
Because consent is always now, not an obligation carried over from earlier.
Exactly. Taking that pressure of future obligation off the table can, paradoxically, make it much more likely for genuine desire to actually show up later.
That makes sense even if it's hard. Because that feeling of obligation, it might feel like security for the higher desire partner,
Yeah.
but it's poison for the other person's desire.
It really can be, which leads directly into pillar 2, mutual respect and boundaries.
Okay, so respect means,
It means your partner has to feel safe saying no, truly safe, without fearing an immediate negative backlash. No guilt trips, no pouting, no silent treatment, no pressure.
that's the ideal, but handling rejection is so tough for the initiating partner in SDD scenarios, that immediate sting.
It is tough, but the goal has to be handling that no with grace and understanding. It's about accepting the rejection of the activity in that moment, not seeing it as a rejection of you as a person.
How do you even practice that? Depersonalizing it.
Empathy practice is really central here, according to the sources. Trying to genuinely imagine swapping roles. What would it feel like to constantly be the one turned down? Or, conversely, what's it like to always feel like you have to be the gatekeeper, always having to say no or feeling pressured?
So the lower desire partner needs to be clear. I'm rejecting the activity, not you.
Yes, and articulate that kindly if possible. And the higher desire partner needs to work on truly internalizing and believing that. It takes real commitment from both sides, which ties into the third pillar.
Which is?
Pillar 3, mutual pleasure and enjoyment. The focus has to be on satisfaction for both people.
Right. The sources were really clear on this.
Yeah.
No taking turns enjoying sex.
Definitely not.
Yeah.
And absolutely no tolerating sex that's painful or just plain boring or otherwise bad for either person.
So if it's not feeling good for both, the script needs to change midstream.
Yes. Redirect, try something different, focus on connection in another way, or just decide to end that particular session kindly. Mutual pleasure is the goal.
Okay, those pillars make sense. Consent, respect, mutual pleasure. Now, how do we bridge the actual gap in desire levels? Let's get practical.
Right, moving beyond just theory. One surprisingly simple tool our sources mention is finding a way to objectify the difference, to take some of the personal sting out of it.
You mean the sex number idea?
Exactly. It sounds a bit clinical, maybe, but it can be really effective because it stops the mind reading.
How does it work?
You each just silently, privately assign yourself a number, say from 1 to 10, reflecting your general level of sexual interest or readiness right now.
Yeah,
Then you share the numbers.
I might be an 8, and my partner's a 3.
Right. And now you see, okay, we have a 5-point gap. The gap is the thing you can talk about rather than you don't want me versus you always want sex.
It externalizes the problem somehow.
It does. It creates a little distance. The problem isn't you or me. The problem is this 5-point gap we currently have. How can we work together on this gap? It loops right back to that empathy practice we talked about.
Okay, I see the utility there.
Yeah.
Now, what about the big one? Spontaneity, or the lack thereof.
Ah, yes. The myth of constant, effortless spontaneity in long-term relationships.
Life gets in the way, right? Stress, kids, work, exhaustion. Spontaneity often goes out the window.
It's usually the first casualty, which leads to the often controversial strategy,
Right.
scheduling sex.
Controversial because it sounds so unromantic, like another chore.
That's the immediate reaction for sure. Isn't that just turning intimacy into another item on the to-do list?
So what's the therapeutic argument for scheduling?
The argument is that it breaks the cycle of initiation, rejection, resentment, guilt.
How so?
If you both agree, say, that Tuesday evening is dedicated time for connection and potential intimacy, you both know it's coming. The lower desire partner doesn't have to spend days dreading unpredictable initiation attempts.
And the higher desire partner avoids that repeated hurt of being turned down.
Exactly. It can actually build positive anticipation, kind of like planning a date did way back when you first started seeing each other.
So you shift the friction point away from the unpredictable initiation and towards the planned anticipation. That actually makes a lot of sense.
It can really change the dynamic. And then, for that dedicated time, how do you build arousal without pressure? That's where techniques like sensate focus come in.
Okay, sensate focus. That's a classic from Masters and Johnson, isn't it? What's the core idea?
It's designed specifically to reduce performance anxiety and rebuild connection through touch. It involves very structured touching exercises, starting with non-genital touch.
Non-genital.
Initially, yes. The couple takes turns giving and receiving touch, focusing only on the physical sensations, textures, temperature, pressure, with a strict rule. No genital contact, no pressure for intercourse, no goal of orgasm.
So you're basically relearning how to touch each other, but stripping away all the pressure and expectation.
Precisely. You're learning to communicate what feels good and what doesn't, purely through the lens of sensation, and rebuilding positive associations with physical closeness.
Are there other similar techniques?
Yeah, things like mindful touch, just slowing way down, really paying attention to the feeling of skin on skin, letting go of any goal, or the 3-minute game.
Oh, the 3-minute game sounds simple.
Yeah.
What's that?
It's a very structured way to practice both giving and receiving touch, and importantly, asking for what you want. One partner asks, "For the next 3 minutes, how would you like me to touch you?"
And the other gives specific instructions.
Yes. Could you stroke my arm lightly? Or could you rub my back firmly right here? The giver just follows instructions, focusing on giving pleasure, and the receiver focuses on receiving and directing. Then you switch.
It forces you to be specific, which is part of communication. What about mental arousal? Fantasies?
Sharing fantasies is powerful, but vulnerability can be a huge barrier.
Yeah, it feels risky.
So one clever workaround suggested in the sources is the sexy dream strategy.
Sexy dream.
You tell your partner, "Wow, I had this really amazing sexy dream about you last night." And then you fill in the details with elements of what you'd actually like your sex life to include, blaming the dream for the specifics.
Ah, that's sneaky. It externalizes the fantasy, makes it less direct.
Exactly. It lowers the stakes, makes it feel less like a personal demand and more like sharing something exciting, a way to test the waters.
Clever. Okay, one last piece on strategies. Context. Understanding our own triggers.
Yes, exploring your brakes and accelerators. What things reliably turn you off sexually? Brakes, maybe stress, mess, feeling unheard. And what things turn you on? Accelerators, maybe feeling relaxed, a certain time of day, specific non-sexual affection.
Knowing your own pattern.
Knowing your context gives you predictive power. If you know stress is a break, but say a clean kitchen and 20 minutes of quiet connection are accelerators, you can intentionally try to build those accelerators into your shared life. That's what intentional intimacy looks like.
Which requires talking about it all. Communication.
Yeah.
Vital, obviously, but so hard when it comes to sex. It feels so vulnerable.
It really does. So the sources emphasize a few core rules for making these conversations more effective. Rule 1, be clear.
Clear how?
Move beyond vague hints or subtle nonverbal cues, especially during sex. Use specific words. Touch me here. A little harder, softer there.
But isn't there a risk of misinterpretation, like you said earlier?
Absolutely. You might say faster and they hear harder or vice versa. So you often need to combine clear words with nonverbal cues, gently moving their hand, shifting your body to adjust the pace. And crucially, use affirmation constantly.
Like saying, yes, that feels good.
Exactly. Oh, right there. I like that. Thank you. Positive feedback is lubricant for communication.
Which leads right into rule 2. Be positive.
Yes. Patience support. These have to be the default tone, especially when you're discussing difficult things, like maybe a position that's uncomfortable or painful or something that just isn't working. Criticism is the enemy here.
So instead of, that hurts, maybe something like,
Maybe, I love that we're trying this, but it's putting a little strain on my back right here. Could we try shifting just slightly, maybe like this? I think that would feel amazing. Frame it collaboratively towards a shared solution.
supportive, not blaming.
Mm.
Okay. And rule 3.
Listen and ask questions. Really focus on hearing your partner, not just waiting for your turn to talk. Practice reflective listening.
How does that sound?
Like saying, okay, so what I think I hear you saying is when I bring up sex late at night, you usually feel too exhausted and stressed to even consider it. Is that right? It confirms you've understood their reality.
It shows you're actually trying to get it.
Exactly. And when you move from understanding to problem solving, always try to externalize the issue. Remember, the problem is the problem, not the person.
Right.
And shift away from complaining about the past. Instead, ask a future-oriented, solution-focused question, something like, if things were to improve for us sexually, what would better actually look and feel like for you? Can we paint a picture of that together?
Creating that positive erotic correlative, as the therapists call it, focusing on the desired future.
Yes. Summoning positive feelings and arousal through positive language instead of getting bogged down in negativity and dread. It's a powerful way to break that negative cycle.
Okay, so pulling this all together, wrapping up this deep dive, what's the core message?
I think the core shift is truly internalizing that STD, this difference in desire. It isn't usually a sign that your relationship or your sex life is fundamentally broken. It's a common challenge.
A normal part of long-term relating, almost.
Often, yes. And it requires a collaborative approach, curiosity about each other, working together, being willing to explore and try new things. It takes effort, yes, but that effort should be aimed at building connection, not at fixing a supposedly broken person.
And the practical key to making that happen seems to be what you called the willingness window.
Exactly. It's that commitment to just show up, to engage in some kind of specific agreed upon activity. Maybe it's sensate focus, maybe the 3-minute game, maybe just mindful cuddling, even if spontaneous desire isn't roaring at that exact moment.
You're showing up for connection, not necessarily with orgasm as the only goal.
Precisely. Willingness to connect.
Okay, so final thought for our listener to take away. You mentioned the sources often link SDD to wider relationship issues, like feeling disconnected emotionally.
They absolutely do. The sexual dynamic often mirrors the overall relationship dynamic.
So here's something provocative to consider. If you think of sex as being like a bridge connecting you in your relationship, what small, non-sexual ritual for emotional connection could you intentionally practice today?
Great question.
Something like maybe a longer than usual hug, or setting aside phones for 15 minutes just to talk, or intentional cuddling with no expectation of more. What could you do to strengthen the foundations of that bridge long before you even think about trying to cross it for sex?
That's a powerful place to start, building the emotional connection that underpins everything else.
Definitely something to mull over and maybe try today. Until next time, keep diving deep.